Bismillahirrahmanirrahim. Today our topic is uterus. The uterus, also known as the womb, is a hollow, pear-shaped organ located in the pelvis of a woman's reproductive system. It plays a crucial role in the development and nurturing of a fertilized egg, and it undergoes changes during the menstrual cycle and pregnancy. Parts. Here are the parts and function of the uterus. Fundus. The fundus is the uppermost part of the uterus. It is rounded and lies about the entry points of the fallopian tubes. During pregnancy, the growing fetus occupies this space. Body. The body of the uterus is main portion between the fundus and the cervix. It is where implantation of fertilized egg takes place. Cervix. The cervix is the lower narrow part of the uterus that connects it to the vagina. It contains a small opening called the cervical os, which allows menstrual blood to flow out and permits the entry of sperm during intercourse. The cervix also plays a protective role during pregnancy, sealing the uterus to prevent infections. Uterine wall. The uterine wall consists of three layers. Endometrium. The innermost layer of the uterus is the endometrium. It is rich in blood vessels and undergoes cycling changes during the menstrual cycle. If fertilization occurs, the endometrium provides a suitable environment for implantation and nourishment of the developing embryo. Myometrium. The myometrium is the middle layer of the uterine wall and is composed of smooth muscle tissue. It contracts during the labor to push the baby out of the uterus and aids in expelling menstrual blood during menstruation. Perimetrium. The outermost layer of the uterine wall is the perimetrium. It is a serous membrane that covers the uterus. Function. The functions of the uterus include menstruation. The uterus sheds its lining known as the endometrium during the menstruation. This process occurs if fertilization does not occur. Implantation. If an egg is fertilized by sperm, it implants it to the thickened endometrial lining of the uterus, where it develops into an embryo and eventually a fetus pregnancy support. The uterus provides a safe environment for the growing fetus during pregnancy. It expands to accommodate the developing baby and contracts during labor to deliver the baby. Menstrual cycle regulation. The uterus, along with the ovaries, plays a role in regulating the menstrual cycle by responding to hormonal signals that control ovulation and the thickening of the endometrium. Understanding the anatomy and functions of the uterus is essential for reproductive health and fertility. Regular gynecological checkups and screenings can help detect any abnormalities or conditions that may affect the health of the uterus.